there's been a lot of conversation about, oh, tweens shouldn't be using the skincare, right? And there's all the concern about the tweens and the overuse of actives. Then there's concerns when you are pregnant or trying to get pregnant or actively breastfeeding about, oh, what shouldn't you expose your fetus to or your baby to? And I just like, hey, ladies, let's take care of ourselves. Like, what about us? Like, what about us? What should us not be exposed to? And I think I love it when people start thinking about these things. And usually, and this is the plight of women, is that we don't start thinking about it until it involves someone besides us, right?
Mm-hmm.
We aren't worried about ourselves as much as maybe we should.
Did you know that your skincare routine can be impacting your fertility and your pregnancy? Today, we will learn from Dr. Heather Rogers how to navigate your skincare routine and choose products that are safer for you. Welcome to the Baby or Bust Fertility Podcast, the podcast with weekly in-depth discussions and topics on all things reproductive health. I'm your host, Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist and former fertility and IVF patient myself, here to help you navigate some of these confusing topics and learn more about your reproductive health every week. I did not learn about endocrine disruptors and the impact they have on our health in medical school or even residency. I had one lecture at the very end of my fellowship at Stanford in reproductive endocrinology and infertility on BPA or bisphenol A and its impact on egg quality. And I had that one lecture and I didn't really think about it again until I was searching for products for myself. And my own patients were asking me questions about endocrine disruptors, phthalates, parabens, and all these chemicals that could be impacting their reproductive health. Here to help us learn about safer products and safer skincare routines is Dr. Heather Rogers, a dermatologist based in Seattle who's created her own safer skincare line called Dr. Rogers Restore. Heather, welcome to the show.
So happy to be here. It is very fun.
I am so lucky to have you as a dermatologist. You are such an incredible human, and I learned so much from you on Instagram and just, all that you are doing. But you are so unique. So I have learned a lot about endocrine disruptors and toxins and things like that. And you are one of the very few dermatologists in the world that's actually educating on this and even created your own safer line of products. You are so unique and I just appreciate you so much.
Well, thank you. And, Laura and I go a long ways back. Like, you definitely took care of me in my time of need. And I am so impressed with what you have built and what you do for your patients, both near and far. So I'm really happy to be part of your team.
Oh, wow, you're amazing. And you do such a good job of breaking down education because it can be so intimidating to really start to learn about parabens and phthalates and BPA and all these things that I remember when I first really learned about it, I had one lecture on BPA and egg quality when I was finishing my fellowship at Stanford. And it really wasn't until many years out where my patients were starting to ask me questions about this that I started learning about it. And when I started really learning about it, I kind of went to a pretty dark place. It's like, I can't even put anything on my skin. I just felt like everything. But how did you come to learn about this? Was this something that you learned about in your residency and your fellowship?
No. And I think as you and I of similar age, like, we've just learned so much more post-residency than what was being taught during our residency. So I think in some ways we benefit that we're both in Seattle, and I too got a lot of questions, and I too was frustrated by how hard it was to advise my patients, not just like during pregnancy, but also just like post-procedure. Like, I do a lot of procedures. I do a lot of laser and do a lot of skin cancer surgery. And when you put things on your skin in that phase, you're going to absorb a whole hell of a lot more of whatever you're putting on. So I felt like the beauty industry was incredibly saturated, and yet I couldn't find things that I really felt good in my heart of hearts having people use when I knew they were going to absorb a lot of it. And big picture, there's so many scary words, there's so many scary things out there. And I think for the consumer, um, you don't even know where to start, right? Like it's
Yeah.
just like, oh God, am I worrying about phthalates this week, parabens next week, forever chemicals? Like, what are these things? Do I need to worry about them? And it's daunting. It's daunting for those of us who spend a lot of time and energy trying to figure them out.
Yeah. So was your first product the balm then? Because you
Yes.
described healing. Yes, that product is absolutely amazing. I use it for everything that I would have used Vaseline for, and I just didn't know the origin of it. I love that.
So the origin of the healing balm was when you're in residency, you were told to use Aquaphor.
Hmm.
Like everyone, every doctor is told to use Aquaphor. Every pediatrician tells their patients to use Aquaphor. And Aquaphor is Vaseline or petroleum jelly mixed with lanolin. And lanolin comes from sheep. Lanolin is a very common cause of allergic reaction, particularly in irritated skin. So if your skin's intact, it's probably okay. But if you're fighting eczema, if you're fighting a rash, if you are healing your skin from lasering, that risk of allergic reaction is reported as high as 66%.
Hmm.
So why are we telling people to use something that is a risky maneuver? And for the listeners, I'm actually okay with Vaseline. Plain Vaseline out of the things out there that you can put on your skin, it is not in my top 100 things I worry about. The problem with Vaseline is that it's petroleum. It sits on the top layer of your skin. It doesn't penetrate. It doesn't actually give your skin food or water or things
Hmm.
to do with. So that's the reason why my healing balm works so much better is it has ingredients that your skin can use. Petroleum is just going to sit on the top, but the
Hmm.
likelihood of it being contaminated, the likelihood of it causing an allergic reaction is incredibly low. And petroleum is really cheap. So if you're worried about a budget, plain Vaseline is actually a great option.
Great.
And I can't say that about a lot of stuff.
Yeah. Awesome. Thank you. What are some top things that you would worry about? I love that you were just kind of like, okay, of these two things, I'm not that worried about Vaseline, but what if you're thinking of kind of red flags? Are there things that you think of first?
So, so I guess big picture, there's been a lot of conversation about tweens shouldn't be using the skincare, right? And there's all the concern about the tweens and the overuse of actives. Then there's concerns when you are pregnant or trying to get pregnant or actively breastfeeding about what shouldn't you expose your fetus to or your baby to? And I just like, hey, ladies, let's take care of ourselves. Like, what about us? Like, what about us? What should us not be exposed to? And I think I love it when people start thinking about these things. And usually, and this is the plight of women, is that we don't start thinking about it until it involves someone besides us, right? We aren't
Hmm.
worried about ourselves as much as maybe we should. Um, and I want to empower people to make good decisions for the entire family, really starting with themselves. And then we come into this world of like what? Like parabens are bad. So parabens are preservatives. They've been around for 60, 70 years. And in my mind, they're a forever chemical because they accumulate in us in the waterways and in our bodies and our breast milk and our urine. And what we know is that really, really small percentages of parabens is actually fine.
Hmm.
But the problem is that they're accumulating and we don't know what that means. Now, that doesn't mean that parabens necessarily cause cancer. We
Hmm.
know that they are weak estrogen mimickers, so there could be some role in our hormones. But what we don't know is you're supposed to be exposed to a few parts per million. But if it's in your face cream and your face
Yeah.
wash and your body cream and your body wash, and it's also in food, like that, because it's a forever chemical, it's accumulating in us, and that may not be a good thing. No,
Yeah.
that doesn't mean you can never use anything with parabens in it. It just means, hey, be aware. I choose to use products with parabens if there's no other option. If I like,
Hmm.
I'm really excited about some anti-aging ingredient I want to try. But for like my body products, for things that are going to be on big surface areas for my kids, I really stay away from parabens. And so
Yeah.
you just can make educated choices without denying yourself everything you want to do. Does that make sense?
Oh, yeah. And I think what's fascinating is when I was doing research into parabens and writing on this topic, I mean, it was named the number one uh, allergen ingredient in the dermatology literature in academic studies for like 2 or 3 years in a row. So most dermatologists are thinking that parabens are this amazing thing that, does a great job of preventing, bacteria and fungus. And like you said, not growing in products, increasing shelf life. And they're sort of learning in their literature, like this is a great thing because people don't build up allergens to it. So to hear you say, hey, I think of parabens as a forever chemical, I mean, that's what makes you so different.
Well, thank you, but it is like it's like we have to think about the whole person, and it takes time and energy to do that, and we're our obsession with skincare has become so widespread. It's seven stages. Like you do 7 steps in the morning, 7 steps at night. You're doing it to your entire body, and so we're just talking about very different levels of ingredients getting into our body than we have in the past or when these things were studied. And that's where you have to pause.
Yeah, well, everyone talks about, oh, well, the poison is in the dose, right? So they'll say, oh, but this amount of parabens in this product is totally fine. Look the other way, it's fine. But you are also one of the first people that talks about like all the number of layers and who's keeping track of, how many products we're putting on and how it's building up. And I think that's really just so important because also I feel like the consumer is just stuck in the middle of, us, talking about like, hey, this is really important. And then this marketing that's saying like, oh, this is clean, don't worry about it. And then you feel so overwhelmed that you're, and some marketing says like, there is no regulation on what the word clean is. I mean, clean has become like a dirty word because it's like, so things are being greenwashed or, it's like sexy. It's like organic in food. Like organic food can still sometimes have pesticides, it's
Well,
just,
no, and you can say clean when you still have parabens. You can say clean when you
yeah.
still have like so for again, like Sephora clean is different than Credo clean, which is different than my clean. And I
Mm.
wish it was regulated, and this is something that you and I've talked about off camera, but fundamentally like why I love Credo is Credo has a very clear definition of what Credo clean means. And it might be stricter than some people want. It might be not as strict as what other people want, but it's pretty darn strict. And they do a very good job of highlighting what that means. And
Mm-hmm.
and something else that also goes down that road is Surette, right? Surette does that for breastfeeding and for people who are pregnant or trying to get pregnant. And what's wonderful about those two options is it hopefully will make the consumer feel better about their choices and
Yeah.
not be so scared about doing the work themselves. Because I can't know everything there is to know about reproductive medicine. Like I have to just keep figuring out derm. That is my job. And so it's unfair to expect the average consumer to really be able to worry about all of these things. However, when they turn to experts for information, so often said experts is being paid to recommend X, Y, or Z and may not be worrying about what they're worrying about. And so that's where when you and I get to just be honest, it's great because like that there needs to be more of that, right? And
Yeah.
unfortunately on social media, so rarely are people just being honest, right? So often there's a monetary reason behind what's being pushed.
Yeah, absolutely. And I love something that you brought up because sometimes people say, well, I love this topic. It sounds important to me, but I go to the grocery store or the drugstore and I look at the back of a bottle and I can't even like pronounce any of these things. How do I find products? And you mentioned one, which is like going to a trusted source that sort of vets products for you. So Credo, incredible. Surette, full disclosure, we're both medical advisors for this new company that's really helping to
Yeah.
find safer products for really surrounding pregnancy and fertility. But it really, like you said, I love that you said, let's take care of us. Like, let's not
Yeah.
just pay attention to this when we're, growing another human. And so finding places that vet, any other things like, there's some, EWG, online or the Think Dirty or some of these apps you can use in the store. It's hard because I know they all have different criteria, but is there any sort of vetting process that you like to or ways that you tell people to look for better products?
So I am very frustrated by the vetting of products by multiple sources, and
Yeah.
I've learned about it because I have a skincare line, right? So I too am riding multiple different horses, and I like to be very transparent about that. But the vast majority of those are pay to play. So if
Mm,
you want to be reviewed, you have to pay. If you don't pay, they won't review you. And then their criteria, I have met without exaggeration with three of the different bigger groups and had to explain to them why castor oil isn't bad or why glycerin isn't bad and about how there's a plant source, and like the level of detail and knowledge isn't necessarily there, and then
mm,
that continues to push the chaos. So and when they started, I was like, this is
mm.
wonderful, like it is a resource, but I've really sort of stopped participating in them because oftentimes information isn't accurate, and it is always, to my understanding, pay to play. And I'm okay
Shoot.
with paying to, like, fine, you pay $300 so they will review your products, like that makes sense. You need to have, but no, you have to pay $5,000 a year, and then you have to pay a subscription fee, and then if you don't, you're not going to be listed in the top 10. So it's all very monetized,
Oh my
um,
goodness.
and that is unfortunate.
I hear you loud and clear. And that kind of game has been played in fertility clinics before, where these outside websites will come in and say, hey, if you want to be listed as one of the best fertility clinics in Seattle, pay to play. And my practice has always been like, no, thank you. Like, we're going to give amazing care and we don't need to do that. I'm disappointed to hear that, but I'm also like not surprised. And I just hate that there's still confusion. So for now, let's maybe point people into Credo and Surette and Dr. Rogers
Yeah,
skincare line.
but so like Credo and Surette are wonderful without question, but I do also think big picture, you the consumer have to decide what's important to you.
Mm,
Like cost, right? Things can be expensive, and if they're outside of your price range, that's something we have to think about. Is it being plant-based, is it being natural important to you, right? That is a priority, I would say, to Credo. But as I said earlier, plain petroleum jelly is not necessarily a bad thing. And so like a brand called Vanny Cream is paraben free, it is fragrance free, it is petroleum based, but it's a great price point, and they have a lot of the basic things that are affordable but also hypoallergenic, so good for people
great.
with really sensitive skin. Then if you go down the road, no, I really want it to be more natural or more plant-based, that's lovely, that usually makes it more expensive. Also, if you have sensitive skin, plant-based products have a higher risk of allergy because they oftentimes have essential oils in them which smell
Mm,
great but aren't necessarily good for your skin. And sort of like what you already brought up, the increase in clean beauty over the last 10 years has also led to a 300% increase in allergic reactions to personal care products. So we're saying,
fascinating.
hey, it's clean because it's plant based, but that doesn't mean it's safe. So, and that's one of the reasons why I made a skincare line, is I wanted something that was first and foremost effective, but then
Hmm.
also non-toxic, but also hypoallergenic, right? And
Okay.
that is an unusual combination of three things, but to do that is expensive. My products are 4 times as expensive as Vanny Cream. So it's not for everyone. And I respect that. And I feel like my job is first and foremost to help people navigate their situation and find where they can feel good about their choices, be it my brand, another brand. It's just helping people think about things in a critical way so they can get where they need to get to.
Yeah. Well, I appreciate that. And I also feel like, especially fertility patients or early pregnancy, sort of you learn about this and it's just sort of all of a sudden I have to get rid of every product in my house and like start fresh, or I'm not going to be a good mom. Like I have to do,
Yeah.
and it becomes expensive. It becomes overwhelming. And I'm curious, do you have tips and kind of red flags for people who are pregnant or planning to be pregnant? Are there certain skincare things that you do not recommend in pregnancy?
Totally. So it took me a long time to get pregnant, and it was very hard for me to stay pregnant. And so um, I'm very aware that this can be a very long, drawn out
Hmm.
experience. And so I'm very careful about what I tell people they can't do when they're trying to conceive, because that can be years for people, and I
Yeah.
don't want to limit things that they can do to care for themselves. So I try to have a very short list of no's when you're trying to conceive. Then the list gets longer when
You're
you're
just
pregnant.
so amazing, Heather. I just want to sit in that for a second because it is so hard to have infertility and to struggle. And just the fact that you have so much empathy and you realize that it's not like just for some people, just a month or two that they can't have their favorite skin cream. I mean, I know that might seem like, silly or superfluous or something, but you're right. Like it really can go on. And so much of struggling, you feel out of control. So you want to take back control. So whether it's the products that you're buying or you're limiting alcohol or you're never having coffee, like it just really starts to take a toll. And there is something really beautiful about taking care of your skin and taking care of you. And so just really just wanted to take a minute to think about what you just said. Thank you. Okay. Now I'm ready for your no's. Thank you.
So my yeses, like if you are trying to get pregnant, I let you get Botox. I let you use tretinoin. I let you use salicylic acid. I let you use benzoyl peroxide. If you are trying to conceive, you are going to know at 28 days if you're pregnant or not. And then we go into okay, what should we stop? Once you are pregnant, I make people stop vitamin A based products. So tretinoin, retinol. Now the studies out there are pretty minimal in those actually being harmful. And I think as everyone here knows, what is safe in nothing's studied in pregnancy, like in skincare, like what's safe in pregnancy versus not safe. Like these are a lot of inferred conclusions based on the nature of the chemicals we're talking about. And vitamin A in high doses orally causes birth defects. This is what we know. This is Accutane. So by proxy, it has been decided that vitamin A topicals should not be used when you are pregnant. Now, we still eat carrots, so it's a little bit fuzzy to say the least, but I do have people stop using over-the-counter retinol as well as prescription tretinoin while they are pregnant. And there's two reasons for that. One, we already talked about that there is a hypothetical risk. The second is that when you are pregnant, your skin is more sensitive. You have more blood flow to your skin. Your blood vessels are dilated. You're going to absorb more of whatever you're putting on your skin, and your risk of irritation is going to be significantly higher. Okay. So A, it may not be great for you. We don't know. Yeah. But B, it could irritate your skin. And like you're already struggling with puffiness in places you've never had puffiness. Like, let's just not make the skin look worse than it already does, right? So tretinoin, vitamin A is out. Salicylic acid is same thing that's in aspirin. And what we really have gotten to the conclusion is that low dose is probably okay, meaning you can use up to 2% on your face, you can use up to 1% on your body, but same thing, it's powerful stuff, it's quite drying, so you just want to use as little as you need to. Mm-hmm. Benzoyl peroxide is one of our favorite acne medicines. And there's a lot of conflict about benzoyl peroxide. So in general, I tell people don't use it. And then very much on a case-by-case basis, if it's the one thing that really works for people, we sort of talk through the pros and cons and have them use as little as possible and the lowest percentage as possible. And then really any prescription medications that you're on from your dermatologist, antibiotics, spironolactone, all of those need to be stopped and really discussed with both your providers. But in general, they all get stopped.
We're going to get back to talking to Dr. Rogers in just a second, but I want to remind you just how important it is to support the show. You could start by sharing this episode. If you find it valuable, if you know someone who uses skincare products and wants to find safer options, share this episode. Another way to help is to follow the show wherever you are listening to this podcast episode right now. Rate and review. If you put a 5-star review in and say a little bit about something about you learned from the show or what you enjoy, it helps us tremendously, and it helps others find this show to help them with their reproductive health questions. So now let's get back to learning more about our skincare and safer options with Dr. Rogers. You talked about Botox pretty quickly, and a lot of my patients ask about that. So because it is in your system for 3 months, right? So you could conceive and it could still be there kind of in that first
Totally.
trimester.
I
Yeah.
always say, let's get you Botox, go home and make a baby. Like, I'm totally fine with that.
That's
So,
amazing. Okay. Tell me
so
more.
Botox has actually been studied in pregnancy for resistant migraines.
Yes.
So
Okay.
it's actually allowed, and the amount that they're putting in for resistant migraines are we're talking hundreds of units, much more than we're putting in for cosmetic reasons. Second of all, Botox migrates about a centimeter into the muscle from where you inject it.
Okay.
Systemic absorption really isn't something that happens.
Hmm.
So it's a very safe thing. It's such a safe thing that I know people who do inject it in their pregnant patients. I just am not going to be the dermatologist who injects their pregnant patients with Botox. That's not going to be me. But it is something where the safety profile is great. Like, and it actually
That's
has been studied.
great.
And I feel very, now, comparison, filler.
Yeah.
Do
Let's talk
not
about it.
get filler. Don't get filler. And the reason not to get filler is because filler makes you puffy. It absorbs
Mm.
water. And when you have a successful pregnancy, you are going to swell. And that is what you're supposed to do. And it really does change the appearance of your face, oftentimes negatively, when
Okay.
you're that puffy. So even with the people where it's a little bit of a long slog on getting pregnant, I do try to do other treatments for them that don't involve hyaluronic acid filler because um, women can be very unhappy with how full their face looks when they have hyaluronic acid filler in their face and they become pregnant.
Okay. What other kind of treatments are okay? Like IPL. I do that about
So
once a year.
yeah, so IPL helps with red and brown. Great treatment. I'm okay with people doing that while they are trying to conceive. The problem with IPL is that if you have melasma or a tendency to make
Mhm.
brown, it can be made worse with IPL. And if you are on hormones, I worry that that risk goes up. So depending on what your treatment plan is with conceiving, sometimes I do try to talk people out of it. The other thing with IPL in pregnancy is that when you're pregnant, your blood vessels dilate. So even if I get them all small and pretty and then you get pregnant, you're just going to open them all up again. So I do encourage people to wait till they're done breastfeeding to do IPL. But there's no harm to you or to a new fetus if you do IPL. It's more just like, is it the best use of your money?
Okay, that's great. That's really helpful. Any other things that you think are safe in pregnancy or not ideal?
So for pregnancy, we really want to moisturize, hydrate our skin, face
Mm.
and body, right? Like, we know that our skin is going to have to stretch so much, and they really looked at like what itchy of skin, dry skin, stretch marks in skin, and you can't prevent stretch marks. You get stretch marks if your mom has stretch marks, if you gain more than 35 pounds, if you're a young mom, if you have a baby before 35, your risk of stretch marks is higher. But there have been suggestions in smaller studies saying that moisturizing your skin with shea butter on a regular basis does make it so that the stretch marks are not as bad, makes it so your skin isn't as dry. So getting into that habit of sort of treating all of your body well, every time you shower, moisturizing, really decreasing on your exfoliation, because that also leads to water loss, just makes it so you're less likely to have an unwanted complication with getting dry, itchy, eczema prone skin. Because a lot of people go into pregnancy not having that tendency with their skin,
Mm.
and then they don't really know how to take care of their new dry skin.
Okay, that's amazing. One of the things that you talk a lot about on your education, whether it's on Instagram or just chatting, is that you don't need a lot of products to have amazing skin. And I love hearing
No.
that. Can you just talk us through kind of your recommended sort of morning routine and nighttime routine? Because I felt like it's so liberating just to, the simple things that you kind of bring up. And it doesn't have to be this like 17 steps, for self-care. Because especially at night, I just want to go to bed. So kind of the key things that are important and what you would recommend to your patients.
Yes, I love this question. So it is so important for people to hear. I'm a number one fan of skin minimalism, and that doesn't mean depriving your skin of anything. It means only using products that have a good safety profile, that you know what they're going to do for your skin. And being really selective in that. Like, just because something's new, something's a fad, something's cool, doesn't mean anything. And unlike a
Mm.
new bag or a new pair of shoes, you're dealing with the largest organ in your body. Like, you are subjecting your body to having to deal with something. And I think people forget that. They think of skincare as beauty or fashion, and it's a very
Mm.
different thing. So whether or not you're trying to conceive, whether or not you're pregnant, you really only need 5 products. And that's for morning and night. So in the morning, you should not wash your face in the morning unless you wake up with oily skin. If you
Mm.
wake up with oily skin, wash your face. Otherwise, you go straight to your vitamin C. And your vitamin C is a morning vitamin C serum that has antioxidant in it that protects your skin from the sun and pollution in a way different than sunscreen. Vitamin C is totally safe to use while you're pregnant. It's
Mm.
oftentimes mixed with vitamin E, ferulic acid, also totally safe to use while you're pregnant. The only thing about vitamin C is that it's an acid that can be irritating to your skin. So if your skin is irritated, you skip that step. But
Okay.
otherwise, on bare skin, you do your vitamin C serum, your day preventative treatment. Then you follow that with a moisturizer, and then you follow that with zinc-based sunscreen. And we'll talk about sunscreen afterwards,
Yeah.
but that's your morning routine. If you have a well-formulated moisturizer, that can be used around your eyes, it can be used on your neck. You don't need a separate eye cream. And what people have to understand is that you should moisturize your face based on what it needs. So if your cheeks are dry, put more moisturizer there. If your
Hmm.
nose is oily, skip your nose. Your eye skin is really dry skin, so put a lot of moisturizer around your eyes. But you should pick a well-formulated face cream that's safe to use everywhere, right? And
Okay.
like, that's what I'm talking about, is just pick safer options. Then your sunscreen. And I don't like my moisturizer and my sunscreen together because A, zinc is drying to the skin.
Hmm.
B, if you have oily skin, you're not going to put very much of your moisturizer on, and then you're not going to get the sun protection that you need. So it's just divide them up: moisturizer, sunscreen. So that's just 3 products in the morning:
Yeah.
vitamin C, moisturizer, sunscreen. Makeup, if you choose to wear it, go about your day. At night, at the end of the day, like, I don't care how tired you are, you're washing your face. Like, I
Yeah.
don't care. Like, you will not hear an acceptance of not washing your face from me. You are washing your face.
Got it.
And like, brush your teeth. You brush your teeth first because you don't want to have the toothpaste on your mouth as you sleep.
Hmm.
Brush your teeth first, then you wash your face. After you wash your face, then you put on your night turnover treatment. Meaning it's something that promotes cell turnover. This is where the retinols live. So this is the tretinoin, the retinoid, retinol that's over the counter.
Hmm.
Those I've told you no while you are breastfeeding or pregnant, but there's still a lot of other great turnover products out there. Now, have they been studied in pregnancy per se? No,
Okay.
but are they widely available and thought to be quite safe? Yes. This is like
Okay.
glycolic acid. This is bakuchiol. So you don't have to give up on the texture of your skin just because you're pregnant. You wash your face, you dry it, you either use your prescription tretinoin, or if you're pregnant, you will use glycolic acid or bakuchiol. Then you follow that with a moisturizer. It can be the same moisturizer you use in the morning. You
Hmm.
might just use more of it because you might want more hydration while you sleep. And then you go to bed. That's really it. It's like, so not
Yeah.
complicated.
No, it makes it so much easier. And even your cleanser, I've started using it as a makeup remover because it's just so gentle. So I've just decreased the number of products like astronomically.
Exactly. And the benefit of that is the load of chemical you're exposing yourself to. Chemical A that can accumulate in you, but B that could irritate you. So it's like, it's more manageable. You first of all, like everything, first and foremost, you get a better result. You're not asking your skin to process so many things. The likelihood
Hmm.
of irritation is lower. So you do less because less gets you a better result. But it also decreases your risk of irritation, decreases your exposure to chemicals. It's less expensive. It's less time consuming. Like, the only reason not to do that is because of FOMO, because of pressure from the world telling you you need to do more.
Yeah.
And I don't know, there's this wonderful book called Clean where it talks about the origin of our obsession of taking care of our skin. And at the turn of the century, soap was invented.
Hmm.
And then to sell soap, they came up with these crazy stories called soap operas. And they actually were on the radio telling stories about how you use soap in like different ways. And it was
Huh.
so lucrative. They were like, we need other soap. Let's try a shampoo. Let's try a shaving soap. And so it was all just figuring out that humans like to buy personal care products.
Yeah.
And like Albert Einstein's quoted being like, are you going to use a shaving soap as well as a regular soap? And he's like, well, no, why? That's too many decisions. I just need one soap, right? But like, think about where we are now, where,
Yes.
oh, we need a neck cream, a hand cream, an eye cream. Like, we don't.
Oh,
We just like to spend money and we like to buy ourselves things.
yeah.
But it does have these unwanted complications, of which irritation is what I see all the time, and accumulation of these chemicals in our body, which we don't know what that means.
Yeah, absolutely. Oh my gosh. I just am learning so much every time. Oh, so I went to Instagram to ask kind of questions, and we've gone through a lot. Like we talked about Botox, we talked about retinol, talked about fillers, talked about IPL. But what we haven't talked about is red light therapy, like all those
Yes.
masks on TikTok. And it's just like, it's kind of the newest fad. Does it work? Does it are there certain
Yes.
ones you should buy? And like, is it okay in pregnancy?
Okay. So, yes, red light does work in the studies. So, what does
Okay.
that mean? Um, so, first and foremost, the wands, no, don't waste your time
Okay.
or money on
Okay.
them. You want a uniform delivery of light, and it has to be delivered low and slow. If it's delivered too quickly, it actually sort of overpowers your cells and they don't know what to do with it. And it
Okay.
increases the risk of melasma from the heat. So, big picture, one, yes, it's safe to use in pregnancy. Two, it's effective at building collagen, helping with inflammation, helping with brown in most people. You want the delivery to be at least 10 minutes long.
Okay.
The two that I've studied the most, and I have no association with either of these brands, is Omnilux and Soluma. So Soluma is actually a half an hour delivery, and you have to
Mm,
do it twice a week, and it's very expensive, but that's sort of the medical grade one. They actually did studies showing that it decreased the radiation burns when people are having radiation for breast cancer. Like, they
hmm.
have some very good data.
Okay.
Then Omnilux has been doing LED light therapy for decades. They have great long history of data, and they have a mask, they have hands, they have necks, and their treatment is 10 minutes, and you do it every other day. And
Okay.
you will see an improvement in your skin at a month, and you really will. Like, everything will just look glowier and nicer. Now, the caveat is, what about people with melasma? And your risk of melasma is higher when you're pregnant. And melasma comes in lots of different forms. Some of it's just related to the increase in estrogen, some of it's related to the increase in estrogen as well as sun, and then others are activated by heat. If
Okay.
you are prone to melasma, I would be concerned about using your red light, because it could, with that heat, activate your melasma and make you a little bit frustrated.
Okay.
I have not seen that in any of my patients, but it is something that it would make sense that that could be a concern.
Okay. Fantastic. You are such a wealth of knowledge. Let's end on a download with sunscreen. What is the deal with sunscreen? It is such a like people get so confused.
Yeah. Okay. So, um, big picture with sunscreen is, we don't know what the accumulation of chemical sunscreens in our body does. Same thing, hormone disruptors definitely been shown to affect hormone pathways in animals.
Okay.
Hasn't really been shown to cause it in humans. And the amount of exposure the animals were getting was literally, they were eating it. It was their weight and exposure. So it was really high
Mm,
amounts.
okay.
Back up. Um, so it sounds pretty good, except for then there was a study that came out about 6 years ago now in the JAMA, where people applied chemical based sunscreens to their entire body every 2 hours at the beach for 5 days. And we were absorbing the chemicals 5 to 100 times more than we thought we were. So
Wow.
these chemicals were approved by the FDA at a certain level, and we're absorbing them so much more than we thought. So that actually led to the FDA labeling all these chemicals as no longer generally considered safe, and asking the companies that make the sunscreen to do research on actually identifying, are they safe. And those studies are happening right now,
Oh,
which is good. It's just a very hard thing to quantify. But
is
now in the
this like the oxybenzoin and those type? When
Yes.
you say
So,
chemical, is that what you
sorry,
mean?
chemical sunscreen, thank you. So yes,
Yeah.
it's benzone, it's avobenzone, it's benzophone, it's oxygenate. It's the chemical active ingredients in sunscreen. And sunscreen is divided into two groups. There are physical based sunscreens,
Hmm.
which are zinc and titanium. And then there are chemical based sunscreens, which is the avobenzone, oxybenzone group. And the chemical sunscreen group was the group where they're like, we need more information. So now in the United States, it's not recommended you put sunscreen on kids under the age of 6 months. There's concern about chemical sunscreens during pregnancy. And this is a lot of inference. There's not a huge amount of data out there. So what I try to empower people is just go with zinc.
Yeah.
Don't worry about it. Just go with zinc. Now, the downside with zinc is it is more expensive typically. It's less cosmetically elegant. It's annoying to reapply. And if you have darker skin types, it can be more noticeable. It can make you look ashy.
Mm.
So I realize those are not great. But if you're covering your body, particularly your pregnant body or your little one with sunscreen, I really want it to be zinc based. And I want people to understand that even if you're really good about your application of sunscreen, sunscreen isn't enough. Like you don't put
Hmm.
sunscreen on, then just sit out in the sun all day.
Yeah.
For yourself, for your kids, like that's not appropriate sun safe behavior. But that doesn't mean I don't want, I mean, you and I live in Seattle. Like when it's a sunny day, I want people out and enjoying the beautiful weather.
Yeah.
But you need a hat, you need sunscreen, you need sunglasses, you need sun protective clothing, and you need to choose to do your activities not in the middle of the day when you're going to get a lot of sun. And the
Yeah.
reason for that is not because sun is bad. There's all this sun is evil. You should never see the sun. Sun is great and it gives us vitamin D.
Hmm.
We just know that sun is responsible for 90% of the aging of the skin. So the wrinkles, the brown spots, that is the sun. And it's the primary cause of skin cancer. So if you're going to be out in the sun, know that you're exposing yourself to those two things. Moderation is key. And you have to think about it more than just sunscreen, because sunscreen, even if you use chemical or zinc, isn't going to be enough in the first place.
Yeah. Fantastic. Oh my goodness. Well, I appreciate all the knowledge that you shared today. It's just like I was writing things down, mentally. How can we learn more? How can we find you if we want to get more information?
So I much like you really try to answer my patients' questions and just be a voice of reason in the chaos. So I am on social media. My title is Dr. Heather Rogers.
Hmm.
Every week I answer somewhere between 20 and 30 questions. I do an AMA every Sunday. I get hundreds of questions. I pick the repeats and answer those. I have a skincare company called Dr. Rogers, and Doctor is spelled out DOCTOR, drrogers.com. But on my on that website, there's a Learn Center, and whether or not you're buying my products, there's a Learn Center, and there's like all of my recommended sunscreens for pregnancy, not in pregnancy, are on there, and just ways to think about skincare when you are pregnant, but also like if you're thinking about retinoids, like I try to answer, there's a whole bunch of information about red lights. So like the hot topics, I just put into blog format and put on there
Perfect.
so that people can find them if they want more information.
Fantastic. We will put a link in the show notes to all of those resources. And I just can't thank you enough for coming on the show today.
Oh, thank you for having me. It's a joy to spend time with you.
I hope you enjoyed this episode. I have learned so much. I'm so fortunate to be able to call Dr. Rogers my own dermatologist, and she is just such a wealth of information. I really appreciate everything that she brings to this topic and what she is doing to help people find safer products. Find this episode and all others on my website, drlorashahine.com. You can also connect with me in two other ways. Lots of educational content on my YouTube channel, on Instagram, and you can follow the link in the description below for my newsletter out every week on fertility newsworthy topics, content and education that I'm bringing you, and then reviews of products and books that I love. Thank you to our friends at Seattle Sperm Bank and Braves Run Production for sponsoring the show. Thank you to my producer, Shannon Perry, and her wonderful team at Audiotocracy. This is your host, Dr. Lora Shahine, and until next week, wishing you love, luck, and pineapples.